Welcome back. I'm now joined by Glenda Bennett, who's a Women's Veterans Health RN at the Grand Junction VA. Thank you so much for coming on the show today.
Sure, I'm very proud to come and to represent the Women's Health Division at the VA.
Absolutely. So tell me a little bit about the services that are offered for women at the VA.
Well, at the VA for women right now, we have a comprehensive wellness care for that veteran. When they walk in the door, they are assigned to a women's health team, and it's family. They have a woman health provider, they have RNs that are women, they have their clerks that are women, and they're treated pretty much like royalty, as some of them tell me. That, we love our women's health team, and so we do that for them. We also do reproductive care. We, if a woman has service-connected infertility problems or they're pregnant, we then are able to send them out into the community and to get care in the community, or at Denver or at Salt Lake, whatever would be their preference.
Okay.
And then we also really work with mental health services. We work with a veteran. If she comes in and she says, I need some help with any of this, they're assigned, they can go upstairs. We have a special response team that they can see someone within 5 to 7 minutes after arriving at the mental health clinic.
Wow.
Right.
And yeah, go ahead.
Yeah, and also we have services for the homeless veteran, homeless female veteran, and so we do wraparound services. We get her health care and get her a place to live and a case manager that works with her.
That's wonderful. And you were talking about the maternity services, and you're actually the maternity care coordinator.
Yes.
That's just something most people don't think of at the VA.
Right, exactly.
Being offered,
so
right?
I have like 10 to 15 women that I follow who are having children or have just had children, babies, and in fact we had one born today, and
oh
so
my gosh.
yeah, but the services are all contracted out with community providers. So that I might have a veteran in Steamboat, and she delivers at the Steamboat at the Yampa Valley Hospital, and she has the doctor of her choice.
Wow.
And then we do a good wraparound, so help them with any kind of breastfeeding, and just really, we love our women veterans.
That's wonderful.
Yeah.
Now, talk to me a little bit about the culture change, because now there's plenty of women veterans, right? Whereas 50 years ago, maybe not so much.
Yeah. Well, even in 2000 and to 2000, almost to 2014, the Grand Junction VA served very few women, and it was just the culture changed in about 2014, and they've said, we need to provide a better, safe environment, a more female-friendly environment. So now the veterans, we have, this is so simple, but we have changing tables in the bathrooms that the women are using, because sometimes a woman would come in and say, hi, I'm here, I need to have an appointment. They'll say, where's your husband? And she had to say, no, I'm the veteran.
Yeah.
And so now we go, hi, well, what can we do to help you? And it's a warm environment. And
Wonderful.
so I just talked to a lady today who didn't come to the VA right out of the service because she says, I didn't know it was a choice for women.
Right.
And another lady said, I had my hysterectomy in 1994, and they had to clear out a whole unit, and I had to walk down the hall to go to the restroom because there wasn't any service for women when I had my care.
Now talk to me a little bit about what you would want a female veteran who hasn't come to the VA yet. What do you want her to know?
Well, I want her to know that she's welcome, that we want the veteran to come. We don't know where health care is going to go, and so I tell every women veteran, maybe they applied 5 years ago, and I say, well, 5 years ago, there maybe have been different standards. Call, and we'll give out the number of how they can call and how they can check on their eligibility. Awesome. And come in with an eligibility person. The other thing is that the VA is just, we know that 7% of the women of the force right now are women, and so we are gearing up to serve them more every day. We have whole health clinics, we have pain clinics, we have mindfulness classes. We're really looking at a lot of alternative medicines, chiropractic, Tai Chi.
Wow, I love that.
Acupuncture, because not all pain can be handled by traditional pills.
Absolutely.
So we're certainly looking at what we can do to help that veteran achieve the greatest of what they want to achieve in their health care.
Absolutely. Now, where can people go for more information?
Well, they can call into the Grand Junction VA, which is now renamed VA Western Colorado Healthcare System, and it is, they call in 970-242-0731, And as soon as they start talking, if you hit option number 3, then that'll take you to a clerk who will be able to get you to an eligibility specialist.
Wonderful. How perfect.
And the other thing that we offer is military sexual trauma counseling.
Okay.
And a veteran does not have to be enrolled at the VA to come up to our mental health and ask for that care.
Wonderful.
Yeah.
Wonderful.
And we have and maybe we can put on the screen Mary McDonald, who is our liaison, and she's our military sexual trauma coordinator.
Absolutely.
And so we know that it's something that has happened, and we're wanting to help the veteran.
Absolutely. Well, thank you so much for coming on the show today, Glenda. I really appreciate it.
Thank you very much.
Yeah, and we'll have all that information on our web channel as well, westernslopenow.com.